So let's talk about symptoms of gluten sensitivity in infancy stages. And so you see here, I've got this list. You've got colic. Now, one of the things that's oftentimes recommended for colic is something called the brat diet. Bananas, rice, apples, and toast. Well, this has gluten in it, the toast, right? The rice has a form of gluten in it, although oftentimes it's referred to as gluten-free. Those of you who are hearing this and it's new to you to hear that rice has a form of gluten in it, you need to pick up No Grain, No Pain and get updated on the medical literature and research. But the brat diet is the most common, one of the most common recommendations for babies with colic. And so that is not something, it's full of gluten. So if the colic is being caused by the gluten, the brat diet's not really going to do much. Babies oftentimes will have hives, and this can be linked to gluten sensitivity, but it can also be linked to wheat allergy directly. So there's a difference between wheat allergy and gluten sensitivity. So if hives are part of the equation, this might be an acute allergy, and this is simple to test in babies. A lot of times with babies, doctors are hesitant to draw labs or to draw blood work, but hives are a sign of acute allergy, meaning acute, that's an IgE mediated response. So IgE is a type of antibody that we produce in response to something that's an immediate threat, and hives are one of the most common symptoms. Now, you can do it in babies and infants, you can do a skin prick IgE test, so you don't even have to draw their blood. This is what I would ask for, is do a skin prick for all the different foods, including wheat and some of the more common allergens, because as you start feeding that baby, if that baby is allergic, let's just say that baby's allergic to wheat and that baby's allergic to cow dairy, right? Well, now mom needs to be aware, because if mom's breastfeeding and she's eating wheat and cow dairy, that baby's going to react to mom's milk. And oftentimes babies are told, or doctors tell mothers or parents, that the baby's allergic to the breast milk. No, the baby's never allergic to the breast milk. The baby can be allergic to what mom is eating, and it makes its way into the breast milk. For example, we know gluten makes its way into human breast milk. And so, if baby's gluten sensitive and mom's eating gluten, this can also create a conundrum or a problem. But hives, another symptom in babies that we see. Eczema on the skin. This really, for tiny babies, especially premature babies whose immune systems aren't fully developed, we'll see this happen where their immune systems aren't developed. They're born by cesarean. They didn't get colonized with good bacteria. They have eczema. There's a gluten issue. Maybe they're getting a lot of cereal feeding. Remember, one of the problems with what's being recommended for infants today is you get a lot of cereal feeding, right? They recommend the wheat cereals, the rice cereals, the oat cereals. Those are like the first foods, those little powdered dehydrated cereals that you add warm water to. This is what a lot of babies are receiving, and this can in and of itself be a major problem. So you've got to look at that as a potential, and eczema being one of those symptoms. Diarrhea, chronic diarrhea, and on top of this, it's diaper rash. So that diarrhea can irritate the bum of the child, right? And it can create irritation, acidic irritation, leading to a diaper rash or chronic diaper rash. Which oftentimes, what do doctors recommend for the rash? They recommend all kinds of creams, but never ask, what's the baby eating? Because that might be what's creating the rash. But this is a very common thing. I've seen this a number of times in children. When we figure out what they're reacting to, gluten included, the rash in their derriere, so to speak, goes away. Chronic ear infections. Remember, gluten can lead to a reduction of immune system strength or immune power, right? And so that can predispose to chronic ear infections. One of the top treatments in babies today is ear tubes, right? Because of that. And so what they do is they put those ear tubes in to drain the fluid from the ears, because that fluid accumulation, remember, the fluid accumulation isn't the problem. So the ear tubes don't really solve the problem. The problem is the immune system's not strong enough to fight off the normal, natural infectious microorganisms that we have in our environment. And so what happens with an infection is you get water or fluid accumulation. So that fluid builds up in the ear, and it builds up, and now it becomes more of a breeding ground for more infection. So that's why doctors put those tubes in. It's to reduce the fluid and to potentially help to reduce the infection. But the problem oftentimes is in the immune system itself. The baby's immune system's not strong enough or not developed enough, or being hammered by food like gluten. Abdominal distension. If your baby looks pregnant, don't give them Gas X, right? Ask what is it that this baby's eating that might be contributing to it. But gluten sensitivity or gluten can oftentimes cause abdominal distension in babies. Asthma, coughing, wheezing, asthma. This is very common, both in infants, newborn, not so much newborns, but past about 6 months of age, we start seeing problems like this develop. It's also common in young babies. So, 2 years and old and older, where they start really developing asthma. And then the doctors do what? What do doctors do for asthma? They do steroid inhalers. Okay, steroid inhalers do what to the immune system? They further weaken the immune system, increasing the risk for chronic infection, increasing the need for chronic medical intervention. So again, this is, what we're talking about, folks, is diet change. And that when it comes to changing the diet versus dealing with all this, which one is harder, which one is easier? In my opinion, changing the diet is much easier. Chronic coughing, chronic sneezing, failure to grow on curve. So if a doctor's ever said your child is not growing with that growth curve that they, every time you go in and take your baby in for a checkup and they're measuring them, they're weighing them, and they're not on that curve, this is a failure to grow. This can be gluten sensitivity. Now, it can just be natural too. Some kids are just not going to be as big as other kids. And if you're a natural family, I can tell you, most people that are living in natural families where they're not eating all the hormones that are coming in through the dairy or through the other foods, the meats and other things, if you're eating natural, organic, grass-fed, free range, you're probably not going to be as big as the other kids because they're eating all the foods injected with and treated with a number of different hormones and hormone mimicking agents. But so sometimes not being on that curve is not a big deal. But if you're not one of those natural families and your child is really small, this could be a hormone issue being induced by gluten. And we know gluten can impact and disrupt growth hormone and create failure to grow at adequate pace. Now, failure to thrive, this is more kind of tiny babies, right? I talked about this a minute ago, that FTT, that failure to thrive. Excessive vomiting or spitting up. One of my sons actually had this problem. We didn't know at the time. This was before I'd gone through grad school, before I'd really learned as much as I know today, but excessive vomiting and spitting up, the doctor kept telling me burp him more, and I was like, there's just no way that this is not an issue with burping. But it ended up being gluten, and that's that. Mental or physical lethargy. Babies should never be lethargic. They should never ever be low on energy, low on smiles, low on facial expression and reflexive movements. Like lethargy in a child, there's a problem. So keep that in mind. If your baby has mental or physical lethargy, that could be a sign of gluten sensitivity. And then developmental delays. And these can be developmental delays. There's many kinds of developmental delays. Obviously, there's growth. There's the mind, right? So is he on cue for words? Is he on cue or she on cue for language? So there's developmental delays in thought processes, developmental delays in maturity, developmental delays in physical growth patterns. And so keep an eye on those. There's a lot of conditions that we're seeing in the autistic spectrum. And the autistic spectrum has actually been linked to gluten sensitivity as well. That's not to say that gluten is the only cause of autistic problems, but definitely is part of that. And so Asperger's, which is a part of that autistic spectrum where they're having developmental delay issues, very common for kids with gluten sensitivity. Okay, let's see here. Did I miss one? I did. Here we go. So yeah, let's pull this other one up here. And let's talk about toddlers and young children, kind of some of the symptoms that we're going to see in toddlers and young children. So one of the things that we have a problem in industrialized countries, America and other industrialized countries, is 50 to 60% of our kids are gaining too much weight. And some would argue this isn't strictly gluten, and I would agree. I would say that a big part of this is carb toxicity, too many carbs, but gluten is a part of it. Gluten can be a part of it because gluten does what? Gluten increases inflammation, and you have to understand what happens when a kid has chronic inflammation. Their cortisol goes up. What happens when cortisol goes up? They increase their water retention. This is part of the weight gain. But it also, cortisol elevations increases blood sugar. What happens when your blood sugar is chronically high? It increases the formation of something called a triglyceride. What's a triglyceride? This is fat. And so what happens when you have too much of this floating around? It gets stored. So if this pattern repeats itself, it becomes cyclical, right? So gluten-induced inflammation, elevating cortisol, increasing water retention, elevating blood sugar, leading to storage of fat. That's what happens to excessive blood sugar. This cycle creates diabetes, right? And we're seeing more type 2 diabetes in children today. We're seeing it in teenagers. That's why actually nurses are now being trained in schools to identify a dark mark on the base of the neck that it almost looks like dark granulated skin discoloration. There's a name for that. It's called acanthosis nigricans, or dark or black skin. But we're seeing this more and more in children, right? So excessive weight gain, and this can be, again, it can be carbohydrate induced, but it can also be gluten induced. Folliculitis on the back of the arms and legs, that rough, red, patchy bumpiness, that can be a gluten sensitivity. It can be omega-3 deficiency. It can also be vitamin C deficiency. But again, folliculitis, common symptom. This is a big one. A lot of people ignore epilepsy. I've actually been called into a court case, seizure disorder, another name for that. But I was called in once on a court case because a husband and wife were getting a divorce, and their children, two of their children, had epileptic seizures with gluten exposure. And the reason they were getting a divorce is because the husband didn't want to go gluten-free anymore, and the mom was like, no, we need the kids to be gluten-free or they're going to end up in the hospital with seizure. And so anyway, I was drug into that thing to basically be expert testimonial that gluten could cause epilepsy. And so there's a lot of research showing that gluten can actually trigger neurological dysfunction in the brain, and seizure disorders just being one of those manifestations. Juvenile diabetes are oftentimes what we would call type 1 insulin-dependent diabetes. Many of you may not realize this, but type 1 diabetes shares the same genetic pattern. Remember I told you earlier you can get genetic tested for gluten sensitivity, and the gene that we measure is a gene called HLA-DQ. Well, type 1 diabetics have the same HLA-DQ pattern as celiac patients. So that means HLA-DQ2 or 8. HLA-DQ2 or 8, same pattern, type 1 diabetics. I've seen cases. I actually saw a case a couple years ago. A young man came to see me. He was in his teens, and he had type 1 diabetes and was told he'd have to be on insulin the rest of his life. We took him gluten-free. He was able to wean off of his insulin and is still today off of his insulin. And I've seen this happen in a number of cases where people were able to do that. It's not that everyone with type 1 diabetes can do that. I'm not encouraging that any of you with type 1 diabetes try to do that alone, going on a gluten-free diet. You need to work with a healthcare provider if you're going to make that attempt, because it can be dangerous. But juvenile diabetes definitely can be linked to gluten sensitivity. Down syndrome, there's research that shows that Down syndrome is linked to gluten exposure. And again, this would be one of those more, we see toddlers and young children when we find that, but this is in the womb and a development issue. Facial rosacea can be a symptom of, so if your kid's got really super rosy cheeks and you don't know why, this is possibly a symptom of gluten sensitivity. Headaches for no reason. Especially if non-traumatic headaches, non-trauma, so like they didn't bang their head, they didn't fall, right? They have a migraine, or they have just headaches, they're complaining of headaches all the time. Another big one is growing pains, and this particularly like bone pain. When kids will lie at night, I've seen cases where kids will cry at night because the bone pain is so great. The doctors are calling it growing pain. What actually is happening is they've got gluten-induced pain. And when we get the gluten out of the diet, guess what happens to the growing pains? They go away. So if your child has severe growing pains and they're waking up at night crying, wanting you to rub their legs, that kind of thing, you might consider getting them tested for gluten sensitivity. Stomach or bowel pain. Obviously, just like with celiac disease, the stomach and the bowel pain can be a major indicator that gluten is a problem. This is another one that it oftentimes gets overlooked. It's spontaneous nose bleeding. Actually, one of my children had this. One of my sons, his nose, you'd just be having a conversation with him and his nose would just start bleeding spontaneously. Gluten can damage can damage the vasculature in the nose, and it will create a spontaneous nose bleed. Actually, in my son's case, this went away completely once we changed his diet. It completely went away. So if you've got a child with spontaneous nose bleeding, you might consider gluten as an issue. Severe allergies. If your child is allergic to everything you try to feed, including breast milk, and you're jumping around from this formula to this special low allergenic formula, etc., you might consider the possibility that your child is gluten sensitive. And then cystic fibrosis is another one. There's research now linking cystic fibrosis. So both Down syndrome and cystic fibrosis, genetic disorders, have linkages to gluten sensitivity. And I've seen cases of both of these conditions that improve. You can't reverse cystic fibrosis or Down syndrome on a gluten-free diet, but you can certainly improve their outcomes. And I've seen that be the case a number of times. So those are some of your major symptoms in older kids. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.